Medurstand-Understanding Medicine.
Professor Aziz Rehman from Medurstand. In my previous videos, I have demonstrated various signs of motor neuron disease, upper motor neuron disease and lower motor neuron disease. And I think since it is a very common question, what are the signs of upper motor neuron disease or what are the signs of lower motor neuron disease, I just thought that I'll make a video on this also. So if you ask what are the signs of upper motor neuron disease, and I think first of all is weakness, right? If there is motor neuron disease, there has to be weakness. And when we talk about upper motor neuron disease, I think mostly we're talking about the stroke. So if somebody has got stroke, there would be weakness of one whole side. And this of course is common to both upper and lower motor neuron disease. There would be weakness. And the second one is, depending upon the duration, the muscle bulk. Muscle bulk in upper motor neuron disease is usually preserved. Even if the paralysis is chronic, the muscle bulk is preserved. Why? Because there is hypertonia. You know, one of the features of upper motor neuron disease is hypertonia, and because of hypertonia, muscle bulk is preserved, because you might not tell which side is paralyzed just by looking from the size of the muscle. Then muscle tone. In upper motor neuron disease, muscle tone is increased. Not always. In fact, there is an initial phase when there is hypotonia and then there is increased tone. And on all body, when you test, I demonstrated the method. As a patient is instructed to keep his body very relaxed, but if you face resistance, that means there is increased tone. So that would be present in upper motor neuron disease, and we have actually a specific pattern of upper motor increased rigidity called spasticity, so, or clasp knife type of rigidity. That is a feature of upper motor neuron lesion. Then hyperreflexia. All tender reflexes on the affected side are exaggerated or maybe exaggerated. So that is another sign. And one important feature of upper motor neuron disease is upgoing planters. You have to know the technique. So, and in very small children, it could be upgoing without any reason. But in adults, upgoing planter on that side, called Babinski sign, is also an indication of upper motor neuron lesion. Ankle clonus or patellar clonus may be positive, and that is very specific sign of upper motor neuron lesion, and that may be present only in chronic cases, not in very acute cases. Once present, I think that confirm the diagnosis of upper motor neuron lesion. Then when we do superficial reflexes, the abdominal reflexes, I demonstrated in another video, and they may also be absent. So these are signs of upper motor neuron lesion. And then you may be asked, what are the causes of upper motor neuron lesion? The causes, I think, anything happening to brain cortex, the cerebral cortex mostly, or the fibers coming down, the axons of upper motor neurons, like for example paralysis, I would think the commonest cause, the stroke, ischemic stroke, hemorrhagic stroke, trauma, abscess, tumor, multiple sclerosis, all these things can cause upper motor neuron lesion. Thank you.